Also, one of the things, the other thing we need to frame, and this has been a big topic of my thinking about things right now, and we were talking about this Tuesday, is because of modern convenience, whether it's food, comforts, whatever, we kind of dumbed down health because, nature, evolution, those pressures that shaped us as humans, they forced us to be on point and develop it. What's considered healthy today. I mean, I talk to people who tell me that they're healthy because their type 2 diabetes is well controlled.
Yes, that is one of the very difficult conversations I have to have with patient families when I hear this statement all the time. They were fine last week, and all of a sudden, and the patient is, 100 pounds overweight, has pre-existing coronary artery disease and lung disease or kidney disease. And I have to say bluntly, your family member hasn't been fine for decades. And so that's kind of this, what we now accept as normal is not normal at all, but it's usual. And people are confusing what's usual to be what's normal. What's normal is...
You're normal, Cathy. That's what's normal.
Completing an Ironman, that is physiologically normal. And people say, oh, I can't do that. And, but that's why as a doctor, I feel the obligation to demonstrate the way. And you don't have to necessarily, I think people have in their minds what it takes to train for an Ironman. And that's also very important because if I can fit it into my schedule, most people can fit it into their schedules. And,
well, and to a point, you're absolutely right, but people need to know, just for relatable, because most people aren't willing to do that. You don't have to train for an Ironman. I mean, just to get 80% of the way there, I tell people getting to the level where you could do, if you're a runner, you could do a half marathon or walk a half marathon, or just anybody can go and do 2 to 3 hours of physical activity,
yes,
or cleaning the yard or walking, going for a hike, 2 to 3, 4 hours of physical activity, aerobic physical activity where you're not wrecked, you're not bonking. That's a good baseline health thing. Now, completing an ultra or an Ironman or a Spartan race, that's icing on the cake, right? And yes, you're going to leverage your health a lot more, but like you say, you're setting an example as a physician by completing an Ironman, but we want the audience to know it's okay. You don't have to do an Ironman or run 100 miles or climb Mount Whitney like I do. You just got to get moving and get the diet sorted out in the lifestyle. So
yes. Yeah, being able to move, being able to move for a couple of hours, half marathon, or being able to carry 2 toddlers under each arm to get out of your house if it were on fire, being able to be an asset to your family in an emergency situation like that and not a liability. I always say to people, if you have to be carried out of your house or carried out of a burning building, you're a liability. And that is not normal physiology. Tarzan is a normal human being, and having that functional fitness. So can you, like most people pay somebody to do their yard work so they can sit down and relax, when what they actually need is to do something for a couple of hours, like their yard work, or something else where you move all day, not realizing that over time, the investment in that movement actually gets rid of that chronic fatigue. And that in concert with being fat adapted, it's so critically important because I know what I'm feeling after Ironman because of the way I eat and train. The actual, you see a lot of athletes get wrecked after a race like this. When this is just, it gives, being fat adapted, doing an effort like that gives you a bounce to a new level of
right. It becomes, as I say, after the event's over, it's another training session.
Oh, it feels so good. And people really, I think, have forgotten what it's like to feel good. And it is normal that even as a 20-year-old or a 30-year-old to be able to keep up with your toddler. Lots of parents are so tired. The kids get up, 5 o'clock in the morning, they're ready to go. And they may have a solid nap in the middle of the day, and they get up and they're ready to go till they collapse at bedtime. That's normal, right? That's that kind of energy. And, obese children are not normal. There's, I hate that I have to give this disclaimer, but as a physician, there is no judgment here about what you're doing, how you look, what you wear. There's no judgment. But I will not say it's okay and it's normal to be obese, or to be unable to, like you said, move for an extended period of time throughout the day, And so it's really important that people understand that